Blythe Winchester was on the call, so I'm going to give her credit, although I don't know where she is. I'm not sure. I think she had to go. Okay, so I've got Carly from Morningstar Care Center, Melissa Heflin from Anchorage Native Tribal Health Consortium, Agnes Sweetser from, Agnes, you're in Nome, right?
No, Galena.
Oh, okay. Give me the name of that town again. Can you spell it?
Galena, Galena.
Okay, that's right. But you're pretty far north in Alaska, right?
We're right in the interior.
Okay, in the interior. Okay, Larissa McLennan is from Kaufman and Associates. She's new. Jonathan Collins, KAI. Sorry, I got to type minutes as I go. Joseph Ray, who's in Washington, D.C. He went to the MCAI conference, so he'll give us an update. Chrissy Hudgens, Administration on Community Living. So our friend Cynthia LeCount assigned Chrissy to this group. Julie Cahoon, KAI. Teresa Holt, Ombudsman in Alaska, which is great. And Amanda from the Hannahville tribe in the Upper Peninsula of Michigan. And they are looking to start an assisted living facility up there. And so yesterday I got an email from Dr. Bruce Fink and from Blythe Winchester, and I put them in touch with Leo Litsky, who is our former administrator and helped us, build our assisted living facility here at Archie Hendricks. And then I also put her in touch with our assisted living manager here, Delia Lopez. And by the way, Amanda, I told Delia that, I had given you guys her contact information. So she's kind of expecting to hear from you. And then also put Amanda's in touch with Agnes up in Alaska. So hopefully with that, that'll all be helpful. Okay? Anybody else? So on our 2018, our last call was January 2018. So for the new folks, we do have a steering committee. We always meet the second Monday of the month for the steering committee. And then the Tribal Technical Advisory Group, Long-Term Care Subcommittee, we are part of that and that committee with John Johns from CMS. And I was actually on that call this past Tuesday. So that's always the second Tuesday. And then we have our meeting the third Thursday, this call. So sometimes it's the same week, which I know is really a lot. So thank you to those who were on the steering committee call. And then we try to do the long-term support service webinar, which is always the fourth Wednesday. So if you're not on that email list yet, you probably want to get on that, the Tribal Long-Term Support Service email list, so you get those webinars. So the one coming up will be February 28th, and I believe it's on the new Medicare card and how that affects tribes. So they're all tribally oriented. So at our call on the 18th, we had Jonathan Collins, Melissa, Sheila Wiggins, who is actually our acting on-paper administrator, who was formerly at Laguna Rainbow, where Joseph Ray is. She left there and is here at Archie Hendricks while our chief operating officer is working toward getting his administrator license. So Julie, thank you for clarifying that. Julie actually put out an updated list of tribal nursing homes and assisted living facilities. I have that list. We'll look at it today by phone. Just want to make sure that the information is accurate to the best of our knowledge. And there was Rick Richards is actually, Julie, you could probably put him as our chief operating officer. That's his current title right now if you wanted to. Let's see. So we got our call-in number straightened out, which is really good. Sheila Wiggins was going to reach out to Isleta Pueblo in New Mexico, Natalie Abieta, and I don't know what happened with that. And Christy will be talking to us about the Title VI 40th anniversary conference. We heard that it was in August. That is when we are going to hold our annual meeting this year. So y'all probably want to know that. Probably going to need to save the date. Christy, do you have dates on that?
No, there are no dates as of yet. So the conference is arranged through a contract that the Title VI program has, but the contract gets renegotiated every April. So we won't find out until sometime after April the exact dates of the conference, but it is expected to be in August in Washington, D.C.
Excellent. I need to know as absolutely as soon as you hear something because we want to get a save the date card out. So I'll at least let people know we're looking at August in Washington, D.C., so at least they can kind of be thinking that direction. So we did talk about the positive outcomes for Alaska Native Elders. I'll let Melissa talk about that if she wants to. There's a new, an updated, and even further updated date on that conference in Alaska. We did have one administrator on the call last time. That was Sheila Wiggins, and she did talk about some different things about facility operations. We did get a report from KAI, and they did reach out to our IT manager here at Archie Hendricks, who set up our website. So if you have not looked at our website recently, I'd really encourage you to. It's tribalnursinghomes.weebly, WEEBLY.com, and I would really encourage you to look at that. I actually shared some resources on our last call. She goes by Dr. Eleanor Feldman. You can look her up. She's written a book called The Savvy Resident's Guide, Everything You Want to Know About Your Nursing Home, but We're Afraid to Ask. It's not necessarily tribal, but we kind of liked the format of the guide and actually talked about maybe kind of doing something on that order for tribal nursing homes. But it is available on Amazon if you want to look at that. She also has a website. Let's see. So it's kind of like the creation of a best practice guide for those entering a nursing home. KEI, did you guys check on that with CMS if they would be willing to help us with that? I think Jonathan or Jonathan, did you have a chance to ask about that, whether CMS, I know you're doing the best practice report, but do you think they'd help us you could help us put together a best practice guide? It's more of like a booklet.
I didn't get a chance to talk to CMS about that. I can add that to my list for my next update with them.
Yeah, see what you can find out on that. And then we did have I'm sorry, go ahead.
Oh, no, go ahead.
We did have a call since our January meeting, some of us, and gave KI some direction, and they have interviewed, is it 5 people, Jonathan?
Yes, that's correct.
So our clinical topic for this year is cultural humility. Our non-clinical topic is on sustainability of tribal nursing homes. We used the culture card, a guide to building cultural awareness, American Indian, Alaska Native, that was put out by the CDC and some other folks. We kind of used that a little bit to direct the interviews. And KAI, since our last call, was able to interview 5 different tribal nursing home stakeholders, which is great. And so they'll be using that to build the best practice report. So I have not seen the draft yet, so I'll let you talk to us about that, Jonathan, just a little bit. We talked about strengthening this collaborative, which I think we need to do. And I have to report that our grant director, Rebecca Drummond, she was here in Arizona and works with Archie Hendricks, is not able to be on the call. When we had our annual meeting back in October, some of us worked really hard at looking at maybe applying for a development grant, a 1-year development grant for this collaborative. And so that is not off the table yet. We're hoping to have a small group of us that can work on that to really get this collaborative strengthened. And that might even be like there might even be like membership dues or something like that. We're just not sure yet how all that would look. But we really, we assigned some people to reach out to different administrators and folks across the country that are currently not really calling in and being part of this discussion. All right. And so I know that Melissa, you did you have any contact with Val or Gerald? You said you did not. I can't remember.
So I just got an email from Gerald yesterday morning that he is interested in helping with the steering committee, and he wants to know what the
excellent
responsibilities entail.
Excellent. Okay, I will get back with him on that. Thank you so much. That's excellent. I'm glad he got back to you. I know we're all busy and it's hard. I get it. So thank you. All right. Okay, so that was pretty much our January 18th meeting. Dr. Jordan Lewis from Alaska was going to be talking about cultural humility, but I think the time, he didn't quite get the time right. So I thought he was going to be on today's call, so he may still be calling in. Hopefully he will, and he'll still be able to talk about that for us. Okay? Anyone have any questions on the minutes? I hope you all had a chance to see them. If not, if you see anything that you don't think is right, you need to send me an email right away so I can get it corrected. So our calls, for those of you who are new, our calls are recorded. They usually last an hour and they are recorded. The steering committee calls are not recorded, but the actual monthly calls are recorded, and they are put on the cms.gov website. So if you go to cms.gov and you click on Outreach and Education, and then you click on American Indian Alaska Native, you will see the area that says long-term support services, and that's where our U.N.I.T.E collaborative is housed on the cms.gov website. So we're very thankful to KEI for all the work they do, and we're doing a quarterly best practice report. So the one at the end of the year was on disasters in tribal nursing homes and how we're preparing, and then this one coming up is on cultural humility, and that will be based somewhat on information provided by Dr. Lewis and also by the interviews that were done. So we're trying to get these best practice reports to be as, membership based as possible. We want this group to be really driven by the people who are part of it, and not just, in other words, we're telling people these are best practices for us rather than us being told what's the best practice. And I think that's probably the way to go. So, all righty. So I am going to go back to typing my minutes, and let's see here. Let's just go ahead and follow our standing agenda. Find it for our calls. All right. Okay, any reported changes to contact information? Just without even going over that list, does anyone have any reported changes to their contact information? Anyone that's on the call today? Okay. All right.
I'll give you my updated phone number, Debbie.
You do, Joseph? Okay. You want to just text it to me?
I'll do that.
Okay, because I think you have my number. Okay, thank you. And then here, I don't know if we'll have a speaker on today's call. If Dr. Lewis comes in, then we'll have one. And so I'd like to hear from the assisted living. Agnes, why don't you go first and kind of let us know what's happening in your world with assisted living, tribal assisted living.
Okay, I got to figure out how to get back to you. Okay, you're not unmuted anyway. We have had probably since I last was able to get on, we had 2 residents, die of their Alzheimer's and dementia-related issues, of course, and being old too. And then we had to transfer one. We're located remotely, and when they need to go to specialty clinics, they need to fly in with an escort, and it's really hard to get an escort because we don't provide escort services. So she was transferred into Fairbanks, where she could see specialty doctors much easier. And so, we've taken care of, when we had the 9 residents, 8 of them had some level of dementia, and some pretty progressed. So that really, took its toll on the staff. So, this has been a really good time for us to do more training, more, processing that experience, those experiences. And now I think we're ready to, accept more residents and hopefully fill those 3 slots soon. But it's, saying tribal people might be stereotyping, but in this area, there's I don't know that it's stigma to sending an elder to a home as much as it is. Gosh, I even hate to say it, but it's selfishness. You know, the tribal elders oftentimes are the breadwinners in the family when, you know, economy is poor and job opportunities are extremely limited and people choose not to work, go elsewhere and work. And so if the elder comes out of the community or the home, you know, they take their money with them. And a lot of them still like to buy their 50, 60-year-old children cigarettes. So that's a big barrier to trying to recruit elders to come in. And what concerns me is the impact it's having on caregivers, home caregivers, health, well-being, addictions, relationships, all of that. So that's, yeah.
So when you say the difficulty with the caregiver relationship, is that once the elder goes into the home or just the stress of thinking about it?
When they remain at home with family caring for them, you know, it takes a toll on people's, the caregivers' marriages, their relationships with their own children, their relationships with their grandchildren, just, you know, in general. Yeah.
Okay. Yeah. And that, I just am finishing my certification with the Reach into Indian Country to give support to caregivers. I don't know if it's actually, the grant ended in December. So if you haven't already been in the program, it's now there's a cost to it. There was like a 3-year window where you could do it for free, but we trained about 16 of our staff. So we're still working with the University on Tennessee to finish that up. But it's very, you know, the amount of, like, there's a whole dialogue that you follow when you're speaking with a caregiver. And Agnes, I appreciated what you said because it's such a delicate issue. It's so, you have to do a lot of listening and really hearing people's hearts about some of what they're going through. Does anyone have any comments about what Agnes just said or anything that you think would be, like, helpful to discuss down the road? I wondered, one thing I thought of, Agnes, when you said that, well, two things actually, when you talk about if the elder's the one that's kind of supporting the family financially, I know what happens then when they get into the nursing home. Like, let's say a family member came and still wanted some money, it would, you know, you almost get into the realm then of financial abuse, right? Whereas if they were just at home, they could do it. But if they're here, it's abusive. Is that correct? I mean, am I thinking that right or not?
Yeah, there's clearly exploitation, you know, and but it's the elder's choice, you know, what they want to do and how they want to live.
Right.
Yeah, so I think, you know, maybe I've thought about this a lot, like for training for medical providers, you know, and tribal people, and the tribal social workers, what have you, on, you know, when and how to have that dialogue about making this tough decision to move into assisted living. Because what happens when they come into assisted living, it's still their home. Our place is still their home, and we're just their arms and legs, you know, and sometimes their minds. And they have no stress. They have money, you know, they're doing things. Like I had one elder yesterday that she wanted some new clothes. I said, well, you know, you have money because there's money we don't touch. And I said, so get whatever you want.
So it's actually, in your perspective, it's actually less stressful on the elder when they go live in assisted living.
Oh, absolutely. I haven't had one that was the case.
That's a really interesting, that would make a really interesting, like, to look at that, you know, with elders that are living in facilities of some type, nursing homes or assisted living versus in the community, and look at how, you know, where their stress levels are. That's a really interesting point. Is there a reason, just real quick, Agnes, and then we'll move on, is there a reason that you can't get escorts? Is it just something you don't want to do, or is there just no people available to be escorts?
There's no people available. Mm-hmm. That would be a real expensive service that somebody would have to pay for. Okay. You mean the cost of to hire the staff, or just the cost of the whatever you, I don't even know how you would transport people. How would you do that? By to and from, and stay in a hotel, and you'd have one caregiver tied up for 3, 4, 5 days. We kind of. Okay. And would you even be able to, how do you go by boat or plane? I guess you have to go by plane, right? Right. Oh, geez. Okay. Well, I know I never made it to Anchorage a couple of summers ago because it was too expensive. The flight was too expensive.
I guess.
All right.
This is Joseph. I wanted to just add to the conversation and say, add to the discussion and just mention that that it's going to take a higher level of advocacy to get those funds from our own tribes. I believe some of the Native corporations perhaps could band together to create a foundation to offset those costs for our Native peoples. You know, it's that resource development. Here in New Mexico, my avenue to improving quality of life for our elders in the pueblos, we have 20 pueblos in New Mexico, and you know, I'm from the Laguna Pueblo. I envision having to work with my tribal leaders that have gaming. About half of the tribes have gaming, and we need to appeal to their hearts to create that foundation for our elders. I know they want to help; they just do not know how at times. We need to prod them to come up to be generous and create that foundation for our elders, not only in our regions, but on a national level for over 500 tribes. So again, that's what I wanted to say.
Thank you. Thank you, Joseph. I agree with you. I think I like what you said about it coming to the heart. I think that's really, really important. So are there any administrators on the call? Any tribal nursing home administrators on the call? Okay, so we're going to move on then. We talked about our clinical and non-clinical topic, and we talked about the annual meeting a little bit, and the long-term support service webinar that's coming up. I don't know about the GWEP in the past. They've helped us. I'm not sure if they're going to be able to this year because I'm not sure if they're going to get funded for another year. June 30th is the end of the Geriatric Workforce Enhancement Program unless it gets funded again, and I haven't heard on that. Are there any QIOs on the call that would like to do a report? Any QIOs?
Hi, Debbie. This is Lisa. I was able just to jump on the call.
Oh, gosh. I haven't heard your voice for so long. How are you?
I know. I'm so sorry. I've been just having so many conflicts with these U.N.I.T.E calls lately, but I've been thinking about you guys, and I'm glad to be able to join the call today. I don't have any big reports from Alaska. I'm still hoping to move along on developing a toolkit for dementia, at least an outline of a toolkit for dementia, so each tribe could kind of fill in the blanks on what is culturally relevant for their peoples. But I haven't made a whole lot of progress on it. It's just in my to-do, in my inbox, I'll say, and hope to keep that ball moving along and be able to share something with the group later.
Okay, what are you doing, if anything, in your area with antibiotic stewardship? Because I know for nursing homes, that's going to be a big deal with the upcoming surveys.
Oh gosh, we've been doing a lot on that. Fortunately, we've got a really great champion in our state at our Alaska Native Medical Center. So at the local Alaska tribal hospital, they've got a public health and Indian health guy there that is just fantastic and speaks quite a bit and has done some work. We also have a really great relationship with our state epi department, and they've done, and the CDC. So we've done a number of trainings for our nursing homes around the antimicrobial stewardship. It's just such a cross-community issue. While there's a focus in the nursing homes, that's something that we got to be tackling across all fronts if we're going to make any progress. But I think where we're kind of getting stuck in our group is just getting some of the providers on board, and then also, of course, just doing the education around the follow-up of making sure you've got labs and that you've got that justification for that particular antibiotic. And that's where, again, this guy from ANMC, his name is Dr. Wilkinson, Thaddeus Wilkinson, but that's where Thaddeus just does a really great job educating providers about, and he goes right into the common antibiotics used in nursing homes and what they're used for and the appropriateness of it. So we've been working with our group. Whether or not I think we've met every intent of the regulation, I'm not sure we're there yet, but I think we've got a good start. And I'm lucky that I'm just jumping on the coattails of a really strong collaborative that's already existing in our state.
Okay. Yeah, I think it's a little bit overwhelming sometimes. I know for those of you who are at a nursing home, you have to have your infection preventionist with phase 3. And I'm currently taking on that role here at Archie Hendricks, but we work with a pharmacy called PharmAmerica. And they had a program, like we got their book and supplies and stuff, but it's not just having like a binder of materials. There's some training involved, but like Lisa said, it's also about getting out there and kind of knowing, like I get reports from our lab and, you have to be in touch with your nurses to know who's getting infections and who's being treated with what. And are we, documenting, like here they document every, if someone's on an antibiotic, every shift they have to be documenting. And kind of looking at the labs that are coming back and things like that to show that you're not just putting someone on an antibiotic without, like Lisa said, like justification. So, okay, that's great. Thank you, Lisa. KAI, do you guys want to give us a quick update on what you're doing?
Yeah, I can provide the update for KAI. So there's a number of things I wanted to just provide an update about some of the working projects that we're doing for U.N.I.T.E that's related. So for the best practices report has been noted, we interviewed 5 individuals for the report on cultural humility. We will submit that report to CMS by March 1st. So Debbie, we should have that over to you shortly as a draft for your review. Then the May topic. So then the May topic will be on financial sustainability. So that we'll begin planning once we complete this current report. Next is the newsletter. So the February.
Wait, don't move on. When will the deadline be for the one on financial sustainability? When's your deadline on that?
Yeah, so we need to submit to CMS by May 1st.
Okay.
Wait.
Okay.
No, sorry, June. That's June.
Okay.
Can't count 3 months out. So so we'll have like a draft ready to go by tentatively mid-May.
Okay.
So for the U.N.I.T.E newsletter, the February issue should be out either later today or early tomorrow. For the March newsletter, the content deadline will actually be February 28th. Just because of the way the calendar lines out, we want to make sure that we're sending out the issue a week before the U.N.I.T.E call. So we kind of have adjusted the deadline there to accommodate. So then the newsletter itself will be going out March 8th.
Okay. So everyone needs to be aware of that because we had said that the newsletter cutoff was always the first Wednesday of the month. But we're trying to get the newsletter out a week before the call so that that's also your reminder about the call. So for example, in March, you would have, the call would be March 15th. The newsletter should go out March 8th. So she's asking that Wednesday, the 28th, we have anything you want in that newsletter, like any updates or whatever you want to say, information about things you're doing, whatever, that you get it to them by March 28th. So we kind of missed the deadline on this month. Is that correct? Because I noticed the reminder that came out for today's call didn't really have the newsletter. Did we just kind of miss that?
Yeah, it was something that didn't necessarily occur to me until it was the deadline, and then I saw that that the way that, so we just kind of missed the boat this month. So,
all right. But it's okay. I just wanted to make sure people understood. In general, we're trying to get the reminder for the call and the newsletter out the week before, like 7 days before the actual call. Okay.
Right. So, and as far as newsletter content, what we're looking for are any updates or success stories that you want to share about what your facility is doing, whether you started a new activities program or you had an event where you were able to take the, elders and residents to some sort of community event, anything like that, just something nice to share, photos or just like a little narrative about what it is that the event was, those types of things are, really helpful just to share and, nice add-ins to the newsletter content, or anything else that you want to share, any resources, upcoming trainings or webinars, anything like that is also welcome. So just, send that to Debbie and then Debbie can get that content to me.
Right. So just send it to me and then I will forward it on to KAI. Right. Good.
Okay, and then so other upcoming items, and I just want to make sure that this stays on everyone's radar, are the CMS LTSS webinars. That series is a monthly webinar that occurs on the fourth Wednesday of each month. Every year, U.N.I.T.E hosts two of the webinars. So those are for May 23rd, and then the second one would be July 25th.
25th, okay.
Yeah,
so the first one will be on cultural humility, is that correct? Okay.
And so planning for this webinar will start mid-April.
Okay. Perfect. So I'd like everyone to think about, because we're going to have to probably make some decisions on our March call about who wants to be on and part of this webinar. In the past, Val Creel's been involved, I've been involved, Melissa Heflin, Tammy, Carly, different of us have been involved. But think about that topic of cultural humility and what you may or may not be able to, work. I mean, you don't have to do all the work. We'll put together an agenda and what we want to cover and all that. But to be a presenter on that call, I'd like you all to be thinking seriously about that because we are going to need some people to be presenters for that webinar. Okay, it's nothing complicated. It's easy. Yeah.
Debbie, I'm going to recommend Jordan Lewis.
Yes, well, yeah, me too.
Yeah. Do you want me to reach out to him?
He was actually supposed to be on January's call to talk about cultural humility, and I think he got the time mixed up. And then he was supposed to be on today's call, Lisa, and I'm not sure what happened today. I didn't check my email too much this morning because I was so busy. So he may have emailed me, and I just maybe haven't seen it.
Okay, well, if he hasn't, if we're losing touch with Jordan, will you just kind of ping me, let me know, and I'll be happy to follow up with him because I know this is really his bailiwick, and I'm guessing he'd be happy to present on that call.
Yes, I would like him to be on the March call and also to be on that webinar in May. So if you can help with that, that would be great. Agnes, I'm going to pick on you a little bit. Would you be possibly willing to be a webinar presenter on that call on the May 23rd?
May 23rd. I could check, but I kind of missed it.
We're getting a lot of background noise. What did you say?
let me see, I'm doing something wrong. Okay, I think I have a commitment then. Why don't you send me an email?
Okay.
Oh, maybe I don't. Maybe it's the weekend before. Send me an email and I'll check that out.
Okay. It would just be a 1-hour webinar. So we usually have the week before, we do a practice run through. And then that week, that day, we just log on maybe 30 minutes ahead of time and then we do the webinar. So as long as you have an internet connection, we'll be okay. So, okay, good.
Okay.
All right, excellent. Thank you. Teresa, do you want to give our ombudsman report?
I'm not sure that I have anything to offer. I would say, though, that in addition to Jordan Lewis, Don Thibodeau is another really good resource.
Thank you. He's also part of the collaborative. Thank you for reminding me.
Yeah, he's great.
Okay. I got him. Okay, and Joseph, you would be great if you could be one of the speakers also. So anything coming from the ombudsman, you know, at a national level, anything we should know for survey preparation, things like that, Teresa?
Well, so I don't know if everyone knows about it, but our staff has been going over the CMS webinars that they produced about all the nursing home changes.
Mm-hmm.
And we found those really helpful. They're very short. They're like, I want to say 30 minutes.
Okay.
So if folks haven't done that, that's really an interesting thing. Because there was some significant changes like around abuse and neglect reporting.
Right.
And of course, the discharge notices, sending those to the ombudsman in your state.
Okay. Is that in phase 3 or is that phase 2?
The discharge notices started in phase 1, the discharge notices. I believe the abuse and neglect reporting is phase 2.
Okay.
But that one was extremely interesting, I thought. It's subtle changes, but not so subtle. Like neglect doesn't have to be intentional. So they're slight word changes, but they have huge meaning changes.
Right. Okay.
Yeah, thank you for sharing that presentation with me, Teresa. I've been going through it. There are subtle changes, but there are changes.
What did you get? Do you have a link to a presentation, or where do we go, Teresa? Tell us where exactly to go to see those things.
Well, I can send you the link to the page. I think there's like 17 trainings all about different issues.
There's a lot.
Okay.
Yeah.
Can you?
I'm sorry, excuse me. This is Joseph. I was hoping to ask a question of Teresa.
Go ahead, Joseph.
Here in New Mexico, the ombudsman system is not functioning well right now, and at Laguna Rainbow Center, we don't have an ombudsman currently. The last report that we got from the former ombudsman was off the record, and that was again, her opinion was that the state of New Mexico wasn't doing their proper diligence regarding the ombudsman program. Have you heard anything on a national level about other entities like ours in New Mexico not functioning properly? And then my second part of the question is there someone I can call other than the state of New Mexico? Because I'm sure that they would listen to me, but I'd like to know if there's a national person I could speak to.
So I know that the state ombudsman's office has had a turnover in the state ombudsman, and now I think they just recently hired a new person. So I don't have your contact info, but so I'm not sure the easiest way to get you that, but I can tell you who the new state ombudsman is. And I know that because I went actually to visit that office and did a tour, and I know that they have actually hired, I think either part-time ombudsman, or they had some volunteers who were American natives, and they were super excited about that because it makes a big difference who shows up at the facility to talk to the elders and who the elders feel comfortable talking to. So I know that they were interested in working with the tribes and the tribal nursing homes.
So you went to Santa Fe, is that what you're saying?
Yes.
Well, thank you.
So there,
Thank you.
I think
Thank
in
you
New
for sharing.
Mexico, it's just a state ombudsman office, and they have different satellite offices. Excuse me.
Do you, again, I'll follow up on that. Thank you for that. We have so many of our elders that, I'm sure all of us are aware, our elders end up in nursing facilities off reservation, away from their homes, and I'd like to see some type of outreach from the state to have a Native American program that can go to the major cities in New Mexico, Farmington and Albuquerque and Santa Fe and Las Cruces, where a lot of our elders end up. And so, again, that's my thoughts. Thank you.
Thank you, Joseph. So we have just about 7 or 8 minutes. I still want to go through the list that I got from KAI. Joseph, do you want to just quickly give us a little bit on what you heard in Washington, D.C.?
Well, just the talk was budget, and we heard this NCAI is based in D.C. at this time, so that we can take advantage of visits to Capitol Hill, and vice versa. The legislators come visit us at our conference site downtown D.C. So we heard a lot from Democratic legislators, and we heard from a few Republican legislators that, of course, made us a lot of promises. And, we just need to follow up with these folks and remind our elders and our community members, especially, that they have a lot of power in their voice if they reach out to their United States senators and representatives. They need to hear from us, and maybe it's just a little squeak, but still, again, that's what I took away from that session. I did get to visit Capitol Hill, but unfortunately the congressman was on the floor voting, so I didn't stay around. He kind of kept me delayed, but kept me waiting, but that's okay. I'll go back again. Again, the budget was just big discussion, and so many Native programs were discussed. I did not see any of the Title VI programs on the chopping block, though, and correct me if anybody else knows if I'm wrong about that. But as far as I'm aware, it wasn't the Title VI funds. Older American funding wasn't up, or administration on aging wasn't there to tell the tribal leadership or ask the tribal leadership for their support on the Hill.
They weren't there? Okay.
No.
Okay.
If
you have the name of a person, that specifically, I'm wondering if we could, like when you say following up a little bit, maybe we could send a letter from our collaborative, because we represent a lot of tribal elders.
That would be so good. We again just need to be part of the process at NCAI and making sure that we follow any of their dates for submission of policy request or what are they called? The request to the floor from the leadership to make amendments to the policies. Yeah. So again, we just and I'll keep the group in tune with those deadlines. And I think
if we know ahead of time, I think we could do something with that. Kind of have a schedule for them, because we've worked with them before. So, okay, thank you.
I just one thing to add, Debbie. I did speak to the vice chair from the tribe, Tahana Otham, Mr. Jose,
Oh, Vernon Jose. Yeah, Vernon.
Yes. And he, you know, again, he's aware of us, and
Okay.
so aware of me, and so, you know, again, we need to keep him in the loop. And the last thing I'll add, and I think this is another key for us progressing into the future with U.N.I.T E. I did speak to the editor and publisher of the Native American Business Journal. His name is Levi Rickert. Levi Rickert is his name, and he wants to hear from us. He wants us to send him an idea for a story. So I think we need to take advantage of that.
Okay.
So,
All right.
that's
Levi,
what
how do you spell the last name?
Rickert, Levi Rickert.
Okay.
He's
All
with
right.
he's the publisher and editor of NativeNewsOnline.net.
NativeNewsOnline.net. Awesome. Okay.
Yeah, they put out a paper, a hard copy also.
Perfect. Okay, great. Okay, sounds good. Probably forgetting something, but I know we're running out of time, so if I forget, I'll try to do a couple little updates in the newsletter before our next meeting. Just real quickly, I think you should have gotten this PDF with your invite this morning. It's the updated list of all the tribally operated nursing homes. We also want to put assisted livings in here. So if you see anything different at Nanolik, in Kotzebue, I have Val, and the ombudsman is Teresa Holt, and Marcella Wilson as the director of nursing, Lisa Johnson with the Mountain Pacific, QAO. Then at the County Care Center in Nome, I have Philip Hofstetter as the administrator, Gwen Minners, director of nursing, Teresa Holt, and Lisa Johnson again. So they also included the ombudsman and the QIO. Any changes in that anyone knows of?
No, that's correct.
Okay, Yukon is Gerald Hodges. I don't see DON is still Liz Lee, which we've all met before. And same ombudsman, same QIO. In the Northwest region, we have the Blackfeet Nation in Browning, Montana. Martha Harrison, administrator. Crystal Cross Guns, director of nursing. Dawn Stokes is the local ombudsman, and again, Mountain Pacific. Pamela Longmire, do you know her, Lisa?
I sure do. She's my counterpart in Montana.
Okay, excellent. She's certainly welcome to be part of this collaborative if she wants to. Then we have Colville and Nespaline, Washington, Sally Hutton, administrator, Janet Gifford, director of nursing. We have Eric Nelson as the ombudsman, and Qualis Health, Jeff West, which is a different QIO, I believe. Any changes on that anyone knows of? Okay, Shoshone Tribe of the Wind River Reservation at Morningstar, of course, Tammy and Carly, yay. Their ombudsman is Annalyn Reeder. Is that correct, Carly?
Yes.
And again, Mountain Pacific. Okay, good. Gila River Caring House. I'm not sure about Ron Preston because I was on their website and they're advertising for an administrator, so I'm not sure. Emily Pogue, director of nursing. Then Rebecca Jennings, ombudsman, and then again, that's our QIO Health Service Advisory Group in Phoenix. Wayne Claw is still at Chin Lee with Verlincia Dempsey, I'm not sure, DON. Violet Peterson, and then, of course, Health Service Advisory Group for their QIO. Okay, ours, I will look at that. Pueblo, Laguna Pueblo, of course. Teresa Williams is the new administrator, correct, Joseph?
That's correct.
Josephine Lucero, who was here in October and came to our business meeting, which we appreciate. And then they have Melissa Cisneros as the state ombudsman, Melissa Cisneros, and Health Insight as the QIO. And then let's see, the Mescalero Apache tribe. So is that care center, Joseph? Is that assisted living or is that a nursing home?
I'm not certain, Debbie. I can't say for sure.
Okay, Julie, are you still on the call? Is that a nursing home?
Yeah, it's actually listed on the Nursing Home Compare CMS website.
Wow, and you called them and talked to them?
We had Larissa made calls and did direct outreach to each of these nursing homes to confirm the points of contact.
So Joseph, take a look at that list that came with your meeting invite and see if you know these folks, okay? In Mescalero, New Mexico. We should get them on the calls. And Red Lake Band of the Chippewa, that was Nick Berg, administrator, Janet Fox, director of nursing, and they report to the Lake Superior Quality Innovation Network. And then, of course, Carl T. Curtis, which is where we have Shannon Sosi as the administrator. And then, of course, the Macy, Nebraska. Oh, that's let's see. Yeah, that's the one in Macy, Nebraska, right? Carl T. Curtis, right? Yeah, that's in Macy, Nebraska, and then the Oglala Sioux tribe, which is in Rushville, Nebraska. And that's Susan Poirier, who's trying to be on our calls. I think she just gets busy. And the Rosebud Sioux tribe, which is the White River Healthcare Center in White River, South Dakota. And then the Oneida Nation, which is the Anna John Resident Centered Care Community in Oneida, Wisconsin. We have that. So if you see anything on here, if you know anything that's not on here, or you see anything that you say, oh, that's not correct, please let me know right away. Mississippi Band in Mississippi, that's Wendy Moran. I've talked to her several times. She's never been on the call. Lisa, are you familiar with Adam Alliance as a QIO?
I know of the other QIOs, but I'm not connected with anyone in that organization.
Okay.
I mean, I know of Keith is probably the only other real QIO person I know from HI.
Okay. And then, of course, the Solid Care Center in Cherokee, North Carolina, and that's David Hunt, who I believe, has anyone talked to David Hunt at all?
I talked to him over text message. I got to call into him, but I haven't heard back yet.
Okay, well, let's see if we can keep getting David Hunt to the table. I'd really like him to continue to be part of this. So, and if anyone talks to Ron Ross, I'm trying to get a hold of Ron Ross also to talk to him a little bit. So, okay, so this is a good updated list. Thank you, Larissa, for the work you did on this, because it really helps to have the ombudsman and the QIO. And our next step is to get all the assisted livings onto that same list, any tribal assisted livings. We want them on the same list. Right, Julie?
Correct. That's the next step.
So we got 3 right now. We have 1 here. We have Agnes's group up in Galeno. And then we have the new folks on the call. So we appreciate that. Amanda, did you want to say anything before we end the call? And I apologize because we're going over.
No, I don't think so.
Did you just want to introduce your area? Yeah, go ahead.
To the ladies from Upper Michigan, I have a question. Are they still on the call?
Yeah.
Part of my outreach at the National Congress of American Indians has been really rewarding. I was introduced to the chairman of the Sault Ste. Marie band.
Is that Mr. Payment?
Aaron Payment. He's the vice chairman at NCAI. And he's told me about some of the improvements that he's tried to implement since he's been the chair with the Chippewas. And so I was just wondering, are you part of their health system?
No, not theirs. We do want to get in contact with them to see if they have anything that maybe they could help us with or give us some ideas. But we are.
I was just going to say, Chairman Payment, I think would really welcome your call. He wants to assist in some way badly, and we're trying to really find out how he can do that. I'm a person with a disability. I use a wheelchair, and so he's heard my message, which is about providing home-based community care for our elders and also other adults with disabilities. So he's heard my message, and he prides himself on saying that he's gone home and tried to implement some of these suggestions and recommendations that I gave to him. So again, I think he should reach out, and we'll connect through Debbie. That's how we'll connect. Okay, Debbie has all the info for each of us, so we'll connect that way. Anyway,
I'll send both of you an email so you have her connection too.
Yeah, thank you.
Actually,
Thank you.
Amanda, stay on the call when we hang up, and I'll get the 2 emails for you because I only have Chris's. I don't have you guys. Okay. All righty. So, okay, great. Sorry to keep you all over. Thank you. We always have a lot to talk about, and I appreciate everyone's time and attention and your contributions to the call. So we'll be in touch.
Thanks,
Our
Debbie.
next steering committee is March 12th, and our next call is March 15th. All right, don't forget we switched time, so it'll be 3 p.m. Eastern, not 2 p.m., okay?
Perfect. Thanks, guys. Bye.
All right, take care. Bye-bye.